Okay, well, thank you for joining us this evening. We have Dr. Nicole, who is owner and provider at Fresno Inclusive, a private practice here in Fresno, California. And then we have three panelists as well, Lorena, Amanda, and Barbie, who will be sharing their stories with us and answering questions as well. So, Dr. Nicole, would you like to share with us a little bit about your practice and the services that you provide?
And it's so exciting to see Amanda from the East Coast. I haven't seen you in a while. Amanda and I did a video for Community a couple of years ago, and Lorena and Barbie and everybody. So, yeah, a lot happened to me. I left my practice in December. I was with Central Valley OBGYN for almost 10 years. And for a lot of reason, I decided to, I was going to say, I'm going to go broke. No, I'm going to go and started my own practice, which is the Fresno Collective for Inclusive Medicine. We have me as a gynecologist. We have Dr. Sam Schmitz as a family medicine doctor. Their pronouns are she, they. They are finishing up residency next year, but because of the demand for their services being so high, we're trying to get them in a little sooner. And we have Dr. Finian Steele, who is a pediatrician, who's going to join us a few hours a week for the youngest people. So Dr. Steele sees patients under the age of 18. I'm trying to twist their arm to do a little bit older as well. We also have Carlos Lopez, who is well known at Transemotion. On a grant raised by Transemotion, Carlos underwent electrolysis training and is currently a nursing student. And I would like to thank Transemotion for setting that up, the machine and everything. And Carlos does electrolysis a few days a week as well. So we are a one-stop shop, not only for gender-affirming care, but everybody looking for inclusive care. And so far, it's been great. We're located in downtown Fresno. We are at a temporary space at 3034 Tulare. And as soon as the renovations are over, we're going to move right next door at 3032. They keep pushing the date. Who knew that getting a building permit would be so complicated? But we're moving along. And after we move to 3032, we're going to transform our current temporary space into a community center. So we already have books from the PFLAG Queer Little Library, activities as basically any organization that needs a space can get the space for free or low cost. So that's me. You're muted, April.
Mhm.
Mhm.
Lorena, would you like to go first, introduce yourself just quickly, just your name and yeah, anything you would like to share with us?
Okay. Well, my name is Lorena. I am 44 years old. I was born here in Fresno, but I grew up in Mexico until I was 18. I am married for 6 years now, and I I've been transitioning for more than 20 years. Um, and it took me many years to decide to take the what I would say the last step of my transition, which is the bottom surgery. And actually, Dr. Julie Nicole is responsible for that because when I met her and I talked to her, she made me feel so comfortable, and she reassured me that this is actually a very safe procedure. That now the all the procedures are way safer than 10 years ago, and it's much easier. So yeah, she helped me to um, make that last step, and I am very happy about it.
Perfect. Thank you, Lorena. Amanda, would you like to introduce yourself?
Sure. My name is Amanda Watson. I am 58 years old. Um, I had bottom surgery in 2015, so almost 10 years ago with Dr. Marcy Bowers. Um, I live in West Virginia. It's way different than California, but I love it here. Um, and I'm grateful for this opportunity.
Go ahead, Barbie. You're muted. It's okay. Zoom can be a challenge. There you go.
Okay. Sorry about that. Hi guys. I'm 39 years old. I've been transitioning since I was 18. When I first started, it was very, very hard. I didn't know where to go, so I started with the legal hormones from the black market, and it kind of like messed up my stomach a little bit. But I gained a lot of weight from that. But then I actually found a real doctor was at the Parent Plan Hood. So I've been with them ever since then. I do have my top surgery. I did get a rhinoplasty, a forehead reduction, and an eyebrow lift. And I'm going for the bottom surgery and a body contouring soon. I'm already processed for that. It's kind of, it's tough, like you have different family members who are supportive about it. And, but the main part about it is I have my mom, she's always been supportive about me being transgender. So was my father. But I mean, in the beginning, I'm not gonna lie, it was tough for her because when your kid, transitions from male to female, and then it's just kind of hard. But she accepted it and she was supportive, of this last surgery. So which is, pretty good. So she's been supportive, ever since then. And, I'm very excited, for this next surgery that's coming up. And, and it's a new journey and I'm very, very happy. And this is like a new chapter because, you don't meet that many trans girls out here. And, a lot of us, are scared to come out because of the community. There's people out there who are not accepting of us. And, we get scared, just to say or even speak or anything because right away people will clock you or say something. But it's normal because no matter what, people are always going to say something, even if you're a man, woman, or no. It's just you got to accept society and just move on with life and just love yourself. And no matter what, don't let anybody trigger you.
Thank you, Barbie. So I'm going to ask some questions of you all, and we'll kind of go from there. And then Dr. Nicole will also answer the questions if she can or contribute to the discussion. But one of the questions is for you, what some of you have gotten bottom surgery more recent. Barbie, you're in the process, right?
Yes, I just got a notification from the Parent Planhood that they did process my papers over with my insurance with Current Family. So, which if everything is going good with them. So, I already was approved last year, but since I had the surgery for my top surgery, they couldn't schedule both at the same time because it would have been a lot, a lot of excruciating pain for me. So,
Okay.
which it, expired. So, thankfully to, April Taylor that she made this happen for me. This is like something excited for.
So we'll talk about kind of like the process going into it, what we need to do to prepare, but also some of the things since everybody's kind of at a different place in the journey. And so one of the things is for our other panel, we asked, well, which bottom surgery did you have? But for us, it's pretty, there aren't, I don't believe, a lot of options. So Dr. Nicole, would you like to kind of share with us the options for that?
Yeah, so there's a couple of options. So 10 years ago, I was doing only gender affirming surgery, vaginoplasty. I was in a big practice in the Bay Area. We were doing 4 a week on average. But a lot in the past 10 years, a lot have happened. So the first question you need to ask is, do you want a vagina? People think that a vagina is everything, but as a gynecologist, I can tell you there's the vulva and there's the vagina. And one thing that we see more and more that there's certain women for lots of reasons they don't want the vagina. They don't want to have to dilate 2 to 3 times a day post-op. They are in a relationship where there's no penetrative sex, so they choose to have a zero-depth vaginoplasty or vulvoplasty, where externally it looks just like a vulva, except you don't have the vagina and what comes with it. So that's the first decision you need to make. The other option is that we have another method now to line the vagina. So historically, we were using the skin, the extra skin that comes naturally to line the vagina, or some people we use the colon, which is part of your large intestine, that they would use to line the vagina. Now they use the peritoneum, and the peritoneum, it's a very thin membrane that lines the inside of your abdomen. It regenerates in 24 hours, and how they harvest that is they use a robot. So you have incision on your abdomen, and they create a flap from the anterior, the front of your abdomen, to create a vagina. So it's a peritoneal flap. So it's pretty nifty. It's not done at every center. But it, especially in younger women who were exposed to Lupron or puberty blocker and don't have a lot of tissue to begin with, that can be a really viable option as well. And that's new, I would say, as of like the past, 8 years or so that they've come up with that method. So we do have a few options. If you look also newer in the past 3 to 5 years, there's certain practices that do penile sparing vaginoplasty, where you have a vagina, but you preserve the full length of the original plumbing. So that's a possibility as well. So the sky is the limit, and you need to have good discussion with your surgeon about what you want, what you need, and go from there.
Thank you, Dr. Nicole. Lorna or Amanda, given that she went over the options, are there anything that you would like to share about the option that you chose, or yeah, is there anything?
I can share. So I had the original procedure that Dr. Nicole is talking about, which is what they call a penile inversion process. At the time, there wasn't many other surgeries being done, at least in the United States, and I probably wish I would have had one of the other options. I'm happy with the way she looks. The way I put it is the garage doesn't work as well, but the garage door looks great. So you do need to think about things like, what am I going to have to do after I have this procedure? Do I have the routine time? Like, I was working full time. It's very hard for me to dilate 3 times a day for the first year. You can't exactly just go find a corner in a hospital and be like, I'm gonna lay down here and do this. So you have to think about the maintenance that's required, what you want. Like, if you don't want penetration, get what they call zero depth, which is basically the vulva, or some people will do like a shallow depth. Some doctors will do like a small vagina, but not the full canal. I don't have regrets about what I did, but unfortunately I had complications, and Dr. Nicole helped me with a procedure to try to help alleviate some of that. Actually, I had to have another of the same procedure done after I moved here in West Virginia, and now I'm at the point where I'm looking at, do I want to have another procedure, which would be the whole surgery basically all over again? Is it really worth it? At this stage in my life, is it worth it? Like, I'm not 20 going out to the bars and hooking up anymore, So be mindful of what you get done, make sure it's what you want. And if you're gonna, pick an option that needs maintenance, make sure you do it. Not for anybody else but yourself. So that's kind of where I'm at in life. And like I said, I'm so happy. Like, having original equipment was not the thing for me. And it took me a lot of years to get there. I've been transitioning since I was 30 and I'll be 58 this year.
Wow. Lorena, was there anything that you wanted to share?
Yeah, well, kind of like I agree with Amanda here that you do have to do your own research. You have to inform yourself as much as you can, because this is a very, very um, intensive, very invasive surgery that a lot of people don't really realize until it's almost time for the surgery. For me, I knew about the PPV, which is the peritoneal, but I tend to scar very easy, and I knew that having that, I was gonna have to have few other scars in my stomach. So, and when I talked to my surgeon, Dr. Pang, because for me, I wanted to have the vagina. I wanted to have the vulva and the vagina. I am married, so I am uh, sexually active with the cisgender male. So I wanted to have the vagina. And when I talked to my doctor, he told me that, because I asked him, I've been transitioning for a long time. So I was kind of worried about the depth of my vagina, right? And for me, I didn't know how long they can go with a little bit of material there, right? But when I talked to him, he said like, we can make it work. Like there's different things that we can do, and I am pretty I am pretty happy. Not 100%. It's very difficult to be 100%. That's something that girls need to realize, because yeah, you go to the surgery excited. You already know that that's what you want, but like we kind of don't know, or a lot of women don't realize that there's complications. That if that you have to be very, very diligent with this, with the dilation. How much time do you have? For me, even though I went 100% by the book, I still didn't get the depth that I kind of like wanted. But at the same time, when I talked to my surgeon about it, he was like, okay, if you want to have more depth, it's kind of like you have to go through like the whole procedure again. And for me, it's like, yes, I love my vagina, but do I want to go through that all over again? It's like, no. So he asked me one question. Um, do you have problems having intercourse? And I was like, I don't. So then, I don't recommend you to go through that all over again. But yeah, so my point is like, um, do as much research as you can, um, because although you can go ahead and have another surgery and perhaps another surgery after, you don't realize how hard it is on you, on your body, until you actually have to do it. Because I recently had to have a revision. Luckily for me, it was just in the vulva, because I had a little bit of necrosis and I needed to get that fixed. So the revision wasn't as hard, and now I am pretty happy. I am pretty happy. I'm happy that I did it. Yeah.
Thank you. We will talk about more of maybe what those complications were that you all experienced and what procedures. But first, going into the procedure, and Barbie, as you're preparing for it, what are some of the things that maybe that you weren't prepared for, or even that you were prepared for to to get ready for the surgery? I know we talked about offering electrolysis. That is a big thing, right? That's something that needs to be done. Um, so what was that experience like? And there is like a time frame where Amanda, you've had yours 10 years ago. Lorena, it's been a couple years, right? And then Barbie going into it. So maybe the prep is the same, but I'm not exactly sure. So what are the things that you're needing to do to be ready for the surgery?
Well, they told me that I would have to get laser surgery down there in order to get the surgery. So, which I think my insurance does cover for the laser surgery. So I am
Oh, the
gonna,
hair removal, the laser hair removal?
yeah.
Okay.
Well, I do wax, so I don't know if waxing's the same.
Mm-mm.
No.
So actually then in that way, Barbie, what we're gonna do, we'll have Dr. Nicole maybe explain a little bit different, but no, you have to have from a lay person, so we'll definitely let Dr. Nicole do a better job explaining. You do have to have the hair permanently removed. I say permanently in quotations because even with laser hair and electrolysis, sometimes permanent is a challenge, but it does need to be more than waxed or shaved to prepare for it. So, Dr. Nicole, would you like to share a little bit more about that?
Yeah, so the hair needs to be permanently removed because the skin that they use will be used to line the vagina. And if you have hair in your vagina, usually even if there's, one, two, five, it's no big deal. But sometimes it can cause infection and discharge, and nobody wants extravaginal discharge as it is. So, as a gynecologist, I can tell you that. So, laser hair removal is a little bit quicker, but it takes still several weeks to months before being ready for surgery. Doesn't work very well on darker skin. So you need to have light skin with dark hair for
Right,
laser hair removal to work best. That's the reason because at Fresno Inclusive, we decided to go with electrolysis because it's used for every skin tone. And also the result tends to be more permanent because it's not
right,
just passing a laser across the surface of the skin. They go, Carlos has the special goggles and you go after each hair follicle. So it's a pretty long process. And, I don't want to, push people one way or another. We do work with some insurance in our practice because it's within a medical practice. So, but you need to take in consideration the amount of time that it takes before surgery. And April, would it be okay for me to put my clinic number and website in the messages?
Yes.
Okay, so I'll
And
do that
so
then.
the other part to that, when she's sharing about Carlos being our electrolysis, he also did a panel similar to this, but for transmasculine bottom surgery. Um, and so the reason I mention that is that sometimes, because we're talking to trans women, the idea of maybe having a male tech do the electrolysis, one, Carlos is a very sweet guy, but the other part to that is being a trans male and understanding what having these procedures or hair removal is like, right? And being with a person who has gone through something similar, we have heard of stories, right, for different electrolysis or different laser hair removal who are used to cis folks going for that and maybe not being the best recipient of trans clients. And so, where Carlos is a little unique in that, right, is that he does understand what that process is like in preparing for this. For some of you who are maybe in Southern California, we can only really offer services for folks within California. Unfortunately, I don't have more resources. Amanda may for West Virginia, but um, there is in Palm Springs a trans resource center. I can't remember the specific name of it. They also have trans folks trained with electrolysis. I don't know how they work with insurance, though, if I'm being honest. However, depending on where you're at in California, um, Carlos's services may be close enough to you. I know Barbie, you're like more South Valley, so I'm not sure what is closer, but it is keeping in mind that finding a place for insurance to cover those services is very hard because it's such a hard process to actually get them to cover it. So I would not wait until closer to your surgery. I would start to work on, for any of you considering surgery, I'd start working on that as soon as you know you've been approved so that you give yourself those months of time because it takes
Right.
several months to do it and then it takes several months to find somewhere to do it.
Right. Would it, okay, so would I need another letter of support for that one as well?
No, that you don't need a letter of support. You just need a clinic willing to bill your insurance, which is what makes Dr. Nicole's Fresno Inclusive pretty unique. We did find when we went to US Path a couple years ago that there are clinics throughout the country that do that, but because it's so hard to get insurances to follow through, a lot of offices, they don't have the staff to follow up on it. So to find somewhere that will take your insurance is going to be a challenge. So keep in mind Dr. Nicole's office. The other part to that is there are places like Laser Away who do payment plans. So that is another option if a barrier is travel to a clinic that does insurance, but there are some places you can find that will do payment plans. They may not be as used to trans clients, but they do offer the service. And so,
Right.
right, the most important part is the service,
Yeah,
right?
'cause
Getting ready for it. So it's just something to consider. Um, for either of you, Amanda or Lorena, was there anything preparing for the surgery that you kind of wish you were maybe better prepared for, or that, yeah, any kind of advice as you're preparing for the surgery?
For me, I think actually a lot of it, so at this point I'd been transitioning for quite some time, about 15 years. And so my whole life was about being a pre-op trans woman trying to get surgery. And I wasn't aware of the amount of like relief I would feel from having surgery. And it became very overwhelming. And once that part of my life kind of passed, I almost went into a depression because it's like, what do I do now? Who am I now? Um, so I think that was the thing I wasn't prepared for emotionally. The other thing is I didn't realize how much testosterone, even on testosterone blockers and estrogen, like impacts your weight and your weight distribution. So I actually ended up having bariatric surgery after I had my bottom surgery because I didn't change my eating habits nutritionally. I wasn't prepared and I went up to almost 275 pounds at one point, from about 215 to 220 originally. So being more prepared about all the emotional and physical changes that would take place. And while we talk about you need to dilate, the reality of that doesn't really hit you until you have to dilate. And then you have to dilate 3 times a day, and it's every day. So I think those are the things that I wish I was better prepared for. Um, and I think we're having more open conversations nowadays than we did 10 years ago. And we have tools like YouTube and TikTok, and we can learn a lot more. But I came kind of how Barbie started. I went to Mexico to get hormones, and I started that way. Because when I came out, you didn't have any resources, and a lot of the trans people gate kept information, whether it was about surgery or medicine or even support. And if you weren't trans enough, you didn't get to transition. And I think we've come a long way, and we need to congratulate ourselves as a community and be thankful for the resources we have
Yeah.
and continue to fight for the resources we have.
It's true. And I think that part, Amanda, about what people maybe go through emotionally, I think is why as W Path, they ask that you all have a therapist session before and after. And for some folks, they don't necessarily experience that, but to have a provider that you are linked with so that if you do experience that, then you do have access to that. I do think it's very honest to talk about the difference when your body adjusts to not having the testosterone anymore because I think often we just try not to think about that piece of ourselves, right? And so not realizing that once you've had the surgery, that part is going to change. But yes, I think that's why WPATH still hold on to that you be connected to a therapist, so that if you do need that support after the surgery, you are connected, so that at least you could look for that. Lorena, what was your piece that you wanted to share?
So mine is a little bit like, I hear stories from other girls, and I'm like, yeah, that sounds, for me, it took me so long, so even before me having bottom surgery, I already transitioned socially for a long time. Before my bottom surgery, I was already married. I never had any issues, honestly, with like the clocking thing. I live a very kind of like normal life, you can say. Uh, and But it took me a long time to actually decide that bottom surgery was my ultimate goal. I thought about it since 2010, but I always heard stories about like, oh, they have so many issues. Oh, they are not gonna be able to have orgasms after, and I was like, I didn't know how to look for that information back then. So, but since like I didn't have a very, very strong dysphoria about my genitals, because I already accepted who I am, right? But there was always that desire. So for me, I will say that the process, it was a little bit easier when it comes to my emotional state, because when I went into the surgery, I already did so much research, that when I had my complication, I was like, okay, well, there you go. Here is another of those complications that I read so much about. So I kind of like already knew what to do. I talked to my doctor, and I went to a wound care clinic. They start taking care of my wound. I start healing. They kept on telling me like, don't worry, this happens all the time. A lot of the times when you have wound dehiscence, the way it heals, it looks even better than what the surgery was going to be. So, I had a very, I will say, very good emotional support. So luckily, I didn't have to go through all of that. And for me, this is a little bit funny, because for me, like after my surgery, I knew that I wasn't going to have any source of testosterone. Obviously, we all fight against testosterone for so long, but a lot of the girls also, and this is something that I want to mention, like after your bottom surgery, make sure to still check on your hormones, because not having testosterone at all is horrible, because it happened to me. After a month after my surgery, my testosterone was completely gone, and then I start having a lot of like premenopausal symptoms. I completely lost my libido, and that I didn't like that. I didn't like how I felt. So uh, one of the things I realized is like, it's not really, and I talked to Dr. Julie about this, it's not really easy to find doctors who understand that part. Like, okay, you've been fighting against testosterone levels for so long, and now you want testosterone. I'm like, yeah, but I don't want to just be testosterone. I just want that testosterone that I need to feel good, that have to have a good sex life. So when it comes to my emotional state, I was really good. I think I did really good. I was lucky enough to have a husband, a father, mother, a family that never questioned why was I doing what I was doing, or you know anything like that. So, but what I would say is like, please make sure to check your hormones after, and please make sure as much as possible to have the emotional support going into this, because I can't say this enough, like what we think we know before going into the surgery is just a very little piece. After you get it done is when the real experience start, and so many things can happen. So what I would say is, like, just be prepared for it as much as possible, emotionally, family. I know not everyone can do that, but if you can, just try to do it, and check your hormones after your bottom surgery for sure.
Just real quick before I have Dr. Nicole talk to us about the testosterone piece, because I have questions about that, so I know probably others do also. But I think as a therapist, to talk about the importance of the support, I want to kind of highlight that being trans is not the reason to need a therapist, right? But sometimes it's remembering to that this surgery, like any surgery, there might be adjustment disorders after. And so keeping in mind that to have the resource of a potentially a therapist, if you don't have the emotional support from people around you, or even just having a professional support versus just your family, but that it could be just seen as an adjustment, right? Like to any large surgery or anything like that. And so just to make sure that I'm clear that it's not that the part about being trans is why you would want to have a connection with a therapist, but just adjusting to something so big and different in your life. It is useful, right, to have that resource if possible. Dr. Nicole, would you like to share like your feedback on that piece about the testosterone? Because I have heard from other clients that adjusting to not having the testosterone is a big thing, but I'm not sure how it works as far as balancing it.
Yeah, and as somebody going through menopause right now, I'm all with you. I have to say, because this is not fun. So we have to keep in mind that everybody has testosterone and estrogen in them. It's more of a ratio thing, a balance of things than when you're a woman, you have zero testosterone, because that's not true. And you still produce a little bit of testosterone. It's coming from your adrenal glands, and it's DHEAS. It's another type of testosterone, and it's nothing compared to what you had before. And some women, they feel so bad that we have to add a little bit of testosterone back to get back some of the libido or um, um, other aspect of testosterone that makes us feel good. We usually use a little bit of testosterone gel, really, really low dose. So usually for a trans man, we use gel, we use 4 pumps. So for a trans woman, we would use maybe like half a pump, or even a pump might be too much, but just a little bit. And if we look at the data coming from menopausal women, we don't have good data to support this, because also cis women can need sometimes a little bit of extra testosterone, especially around the time of menopause. So we do prescribe it as well. But I agree with Lorena 100%. It's not a reason to feel terrible. Come back, we'll check your levels, and we'll find a solution. It's especially hard after surgery because after surgery, your testosterone is gone like poof, like this overnight. It's not like menopause where things, putter down after a few years gradually. But yeah, absolutely, we can help with that. This is a really common, and there's no need to suffer.
I think that is an important discussion to have with providers leading into your surgery, because I would say that that's not something that, um, yeah, that I have the conversation with folks pre-surgery when I'm doing the letters, that's something to, ask your doctor about if you're not feeling well. So, um, hopefully the surgeons are giving you a bit of a heads up about that. But I had no idea. I did know that we made testosterone and estrogen, that everybody made both, and I just wasn't sure how you leveled it out. So that was useful information.
Yeah, unfortunately, I'm going to add that a lot of the surgeon will ask you to stop your estrogen before surgery because they're afraid of blood clot. We have more and more data that doesn't support that. So especially when we go to WPAT to the surgeons conference, the noise being louder not to stop estrogen. Unfortunately, it's really hard to change the mind of plastic surgeons sometimes. Me personally, when I do surgeries on women, I don't tell them to stop their birth control pills. So I don't see what's the big deal, but definitely before surgery, have a conversation with your surgeon about, do I need to stop my estrogen? And I heard that it's becoming more obsolete and having that conversation because being off hormones for some people, like up to 6 weeks before surgery, I personally think it's cruel, but it's not going to make you feel good at all. And I don't know, Florina and Amanda, you had to stop estrogen before surgery and how it felt, but we're pushing for a change for that.
I didn't. Luckily, um,
Who was your
a
surgeon,
line.
Lorena? I'm sorry.
Yeah, can you hear me?
Yeah, who was your
Yeah,
surgeon?
it was Dr. John Harry Pang.
Okay.
So with him, he actually made it. I mean, the information that they give is pretty good. I didn't have to have electrolysis or laser hair removal because they do the scrapping. Some women, they still want to do it even though the surgeon tells you it's not necessary we do the scrapping here. And a lot of them, they say like, well, I don't want to risk it, so let me do laser hair removal or electrolysis. But for me, um, he didn't require that. And also, they didn't require me to stop estrogen at all. So they made it pretty easy.
For me, I did have to have laser hair removal. Luckily, as you can tell, my skin is extremely white and my body hair is darker than my natural hair. I did have to stop the estrogen. That was the doctor's requirement. And I honestly have never felt so sick. As soon as the surgery was over and I came out of recovery, I was sweating and shaking and felt nauseous. I mean, it only lasted like maybe 6 to 12 hours, but it was the most horrible feeling in the world. Imagine all of a sudden one day you wake up and you go into instant menopause at full force. That's literally what I went through. So I'm glad to hear they're trying to make changes.
Dr. Nicole, do you know what Lorna's talking about when they're talking about, did you say scraping? Because that
Yeah.
sounds horrible.
No, it's not that horrible. I did my fair share of scraping in my days 10 days ago. So basically, once the skin is harvested from the scrotum and the penis, somebody, usually resident or while the plastic surgeon continues the surgery, goes and with a bovie, which is electrocautery, cauterize each hair follicles on the skin. It's not as good as electrolysis. We don't have the same goggles, and basically it's based on us destroying each hair follicle. So I'm glad that Dr. Pang does this because that you don't have to do electrolysis, but it is not, unfortunately, I think, as thorough as electrolysis because it's done really quickly, buzz, 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 during the time of surgery. So yeah, but that's a good question to ask the surgeon, uh, especially if you go for penile inversion. Like, do you use electrocautery on the hair follicles during surgery? But as they put together the graft, they're gonna go and buzz those little hair follicle.
Okay. Yeah, when she said scraping, I'm like literally envisioning like, yeah. So that's why I was like, oh, that sounds awful. I mean, I think that I'm assuming that's also individual to individual, depending on the amount, right, of hair that that person has. The doctor may feel like, okay, this isn't the best option for you or whatever, like each individual person. Um, so both of you talked about complications that you experienced during the recovery. What maybe are some things that I know, Amanda, some of your complications were much down the road, maybe not complications, but results of not dilating. But what were some of the initial, any complications that either of you had within close time to the surgery?
So, fortunately, I had a very older doctor for primary care. So, since my doctor's not in the area, I had to travel 4.5 hours each way to get care for my gender affirming stuff. She was just like, go see your primary care, make sure, like, go see your primary care in a week, make sure you're healing okay. I went in, paid a copay, didn't feel right, something seemed wrong, and was basically told I don't know what I would be looking at, goodbye, and didn't even get my copay refunded. That's a whole another nightmare story, but I was getting granulosis, so I was getting like sugary like substance downstairs. So luckily, thanks to iPhones, I snapped a picture, was given the surgeon's phone number, personal phone number after my surgery, and was like, "Hey, I think I'm having complications." She's like, "Can you send a picture?" I sent a picture. She's like, "You need to get seen." So I had to get in a car and drive 4.5 hours again, mind you, not feeling well, to have her look at it and go from there. My complications later were not actually not from dilating. I was dilating. I got really sick with the flu for like 3 weeks and didn't do my routine as well, but I had what they call like a vaginal stenosis. So I had like a knot, basically, is the way I explain it. So I had a canal, and then I had a hole, and then I had another canal. Um, so if you think like how like a balloon, sometimes it gets like that rippling ridging, it was kind of like that. Um, and then at that point, the doctor that did do the surgery was like, "Oh, just stop dilating because I'm going to fix it." But we never got there to fix it. So didn't have another $6,000.
Right, because this was also during the time before it was considered medically necessary.
I did get blessed, so the surgery was covered, but basically my insurance at the time was like, you already have a vagina, just like with a lot of women, if they wanted implants, they're gonna be like, you already got breasts, you're not getting breasts, you know? So it was kind of like, you already have a vagina, so we're not gonna give you another new vagina, if that makes sense.
Got it.
I work in the insurance world, so it's not fun.
Yeah.
Um,
For you, Lorena?
yeah, so for me, I had a complication pretty much as soon as they removed the vacuum that they put nowadays, you know, to like suck all the fluids. So they removed that, and the next week I started noticing that there was pieces of skin on my um, in the very bottom part of my vagina. What is it called? Perineum. Yeah. So I noticed when I was dilating, I noticed pieces of white skin, and I'm like, why is this happening? And I was dilating and I was doing everything like I said by the book, but then I noticed this, and what Align does is like, at least when I did it, they're pretty good at replying fast if you send them pictures and stuff. So um, I have to, because I am in Fresno, they're in San Francisco. I also have to drive 3 hours, and you know, like, yeah, that's like Amanda's saying, like when you recently had your surgery, no matter if you are under medication, it's still very, very uncomfortable. That's something that I didn't expect, or expect that it was going to be so uncomfortable to sit for a long time after, right after the surgery. It took me like 6 months to sit comfortably. So I noticed these white pieces of skin in my perineum, and I was like, what is this? I tend not to like over worry when I don't know exactly what's happening. So I went there, and yeah, so this white skin, it was already dead. So they had to remove a big piece. So right then, that's when I got a little bit scared, because they needed to remove it, and it was like, I would say, like almost the half bottom part of my vulva. So it was very scary. You can see the rawness of my meat there, under the skin. But they said, don't worry, this sometimes happen. We need to let it heal. So you're gonna you're gonna have to let it heal by second intention, which is like when your body start creating new skin. So that was the challenge part for me. I was still dilating and stuff, but I never thought that I was gonna have necrosis, and apparently it's something that happens a lot because of the stitches, the tension. Sometimes the tension is too much. It's a very vascular area, so there's different situations there. So yeah, it was the scary part for me, but luckily it healed well. Um, Unfortunately, like after it healed, well, I was left with one of my lips was half, the other was uh, detached from the. So I needed some cosmetic, and also the scar. It was very wide, so it became a little bit difficult for me to be intimate. So that's why I needed to go for the revision after a year. But yeah, just keep in mind that necrosis is part of the complications you might get. Luckily, I never had a bleeding complication. Like I said, I dilated by the book. I didn't lose any depth. So, but yeah, when you have those kind of complications, it can be very mentally taxing. So just be prepared that those things might happen.
I think I want to say, April, to anybody listening, or even to Barbie who's going through the process, every surgery has risks and potential complications. If it's what you want and what you need, do not be scared to go forward. Just do your research and know what you're preparing for.
Yeah, I agree.
Thank you for saying that, Amanda. And if a doctor tells you they have zero complication or they have never had a complication, run the other way because they're
Yeah,
lying to you.
They're either
You know,
lying or very new,
Yeah.
right?
but
And
in
both things
residency
are
they should
concerning.
have, yeah, or very new. But when I was a resident, one of my attending used to say, if you don't have complication, it's because you don't operate often enough. So,
Right. Yeah. And I think to add to that, a lot of people would say maybe very eager to have the surgery, right? And so if you have this surgeon who maybe isn't making you feel the most comfortable in answering your questions, but you're very eager to have the surgery, so you're pushing ahead anyways, I think it's more important to realize that if there are red flags, that you respect those red flags, right? And that the complications there are likely going to be something that is a complication, but how bad that complication is and how prepared the surgeon is to remedy the complication really matters. And so if that surgeon is not feeling right for you, to not push ahead, to try a different surgery center and find somebody that you do feel is more prepared and able to address your concerns. And if you feel like they're not answering those questions, to definitely start questioning even more. Barbie, was there anything that you wanted to add or that you had to add that you would like to ask about the things that we've talked about?
Yeah, they were just telling me that I would need a second letter of approval for the vaginal thing.
Mhm.
But where would I start with not the laser hair, but the other thing you had mentioned?
The
I don't.
electrolysis.
Yeah, the latrosis. I'm sorry.
So just to cover the letter piece, for bottom surgeries, they do require two letters of support. Sometimes your primary doctor will do that, or even the person who's giving your hormones will do it. The hard
Yeah.
part is that a lot of surgery centers and insurances want for one of your therapists to be someone you're established with, meaning that you've had regular therapy with them. So you definitely want to clarify. Sometimes it can just be for two people like myself who the only relationship that someone may have with me often is just for the one letter of support. We may not see each other continuously. Sometimes they want you to have a letter from a provider that you're seeing regularly. So I would definitely ask about that to make sure they don't need someone that you're actively working with.
No, they
But
just specifically told me that I just need to see another therapist just to get another approval, and then they can go ahead and process the papers. But they said in the meantime that they are gonna do the body contouring. They're gonna start that and then the throat to remove my Adam's apple. In the
okay.
meantime.
So there is it's called the Gallup. So and then GALAP.org. That website for any of you looking for just letters of support. If for any provider who is on this list, they're agreeing to do the letters of support for free. You'll find me on there. There's a handful of providers throughout the state of California and any state. So for any of you watching outside of California, Gallup is still a site. It's thegallup.org. It's still a site for you to go to look at. You'll see providers in your state that offer the letters of support for free. So you could go on there, Barbie, for your other letter, or there is someone here in town. Her name is Mandy Castano, I believe is her last name. She
Oh
also,
yes, you send me her
yeah,
information.
she also does the letters of support for free, but um, Gallup is a good one for any of you looking because it does offer it state by state. So, and everybody on the list to be on the list agrees to do it for free. Um, the electrolysis, again, Dr. Nicole did put her website in the comments for anybody in the area to Fresno or travel wise. Otherwise, you would just have to do a lot of calling around. I would say that for those of us who need hair, for clients who need hair removal before their surgery, um, this is the harder part of the process is finding someone to do it. That is the slowest part. And so it is going to be a lot of calling folks. And
I
so,
know that a lot of trans people here, like, I don't know where they're going, but a lot of them, like four of them that I know have they got their bottom surgery done.
yes,
And they got it.
I have a client here in town who did it at like a med spa. They did laser hair removal, I believe, and it was affordable. However, the service was not, their experience was not good. So it's really balancing affordable with the care they give you when you're there.
Right.
And so balancing that. So it's something for everybody to kind of consider, right? Is that as you're doing the preparation for the surgery, not everybody who does the service is prepared or knowledgeable for trans clients who are getting this done. And so I would connect with the women that you know who've had a vaginoplasty and did hair
They
removal.
actually kind of like, well, like when you're from Bakersfield, you come from a small community, and then a lot of the trans people here don't get along because they think that, oh, I got boobs or I got hips or I got this. Like it's like a competition, and I'm just like,
It's back to what Amanda was saying about gatekeeping, right?
yeah, exactly. So they won't tell you. So what like I said, like I asked her, but they're going through another. I'm going through parent planhood, so and they're going through Sierra Vista Clinic. So I don't know how that works, but I heard like a lot of bad experiences from them. Like a lot of transgender people who've been starting have switched over to the parent planhood because of the process weight and stuff, and you
If
know,
it's the Clinica Sierra Vista like we have here, it makes sense. It's a little bit challenging. They're just challenging to have as a provider in general.
and then the
Uh,
insurance you might have to.
yeah. So, but I would reach out to Dr. Nicole's office to see about if traveling to Fresno is an option for you. If it's not, it's definitely us looking for different resources.
I mean, I'm pretty sure. I mean, it's because They did it for San Francisco, but they got that, they extended that with my insurance, but that was already processed. But I'm pretty sure I could recommend that, or maybe you could send something out to them or something. You send something out to them.
You would have to start the process and see if they'll cover electrolysis, and then we would kind of go from there.
Okay, yeah. Well, I can write her for my patient portal after we're done with this later.
Yeah.
And they'll write me in the morning. But yeah, like they had just they had the RN there, the counselor on site at the parent planthood. She explained to me about the vaginal, and she told me the complications, and just all the stuff that be prepared for it. But like she did mention the hair stuff, but she didn't say that. She said laser hair removal, so I didn't know about the other one. I
I
don't
would
know
also
how to pronounce
say it
it.
sounds like talking to your surgeon to see what options they have or where they would recommend. It's sounding like that's also something that others have done that's been very helpful for them, because even after your consultation, if they do what Lorena was the scraping, if they do that and you're eligible for that, that might also be an option. So I would reach out to the surgery center that you're going to see if they have any resources. Because I know in San Francisco, a lot of the surgery centers that's all they do. I can't speak for other ones. I primarily work with the San Francisco ones. They have a lot of resources to give their.
But they won't. My insurance doesn't cover there,
Okay,
so
so whomever you have, your
it's the
surgeon, ask them.
University of Los Angeles.
Yeah, so I would reach out to them and see what resources they have, because
Yeah,
if
but
that's
they're
what
not
they
going to start
do,
the. Yeah,
yeah.
what they said was is they're not going to start the process till I get the letter. So, which I have to contact Mandy.
Hmm.
I did leave a voicemail, but
Okay. I would
but
also reach out to the people on the Gallup site.
on the Gallup too. Okay,
Hmm.
so I'm gonna do that most definitely. But yeah, this is something I've been looking forward to, and I'm kind of nervous about it. Like like Lorena was saying too, and the other girls were saying that they were saying a lot of bad things about it. But I think sometimes people want you to be scared, like they don't want you to get that surgery. And
Yeah.
and one of the trannies was like, "Oh well, it can get infected and you can die and blah blah blah." But I'm pretty sure that's because if you don't clean it and you don't take care of yourself.
And
But
if you don't
everybody
call
has
the doctor.
complications. Everybody has complications. I mean, no one's going to be perfect, and no one is going to just like, okay, well, I'm going to get the surgery and nothing's going to happen. No, that's not going to happen. Even after when I got my boobs, I had a little complications. Like the surgeon, she forgot the nasal strip on my nose. I went down there to get it taken out, and she forgot one of them there in my nose. So when I was taking a shower, it fell out.
So the surgeon does matter, right? So it does go back to the surgeon and their care really matter. But I do think part of it is when we're doing as the professional, we have to do the W path. So the W path, for those of you who are listening, is the World Professional Association of Trans Health. They kind of set the standards for how we go about this and what the medical necessity are. So some of us, um, therapists or professionals who are preparing you for this process, we are only given some of the facts, but sometimes our delivery is not good, right? And so we're told we have to go over complications with you, but sometimes our delivery as the professional who hasn't gone through that and who doesn't do the surgery, maybe our delivery isn't the best. And so if this is something that you're considering, I would say that even though maybe the therapist who wrote the letter and the nurse or the doctor at Planned Parenthood, they've gone over everything with you, still make the consultation for the surgeon and have the conversations with the surgeon also so that you can get reliable complication possibilities or remedies to that, right? Because some of us in this process, we don't do the surgery. We don't actually know the statistics of it all. I know a little bit more just because of my relationships with different doctors like Dr. Nicole, but some of us don't have any of that. And so when we're giving you warnings, I think sometimes our delivery is very poor. And so making sure you're getting input from several professionals, not just the person at the clinic and then the therapist who's writing the letter, because the surgeons are going to know more. Lorena, what was it that you would like to input?
Um, no, so I totally agree that So I don't know if I misunderstood, but this from Barbie, but it's true that a lot of, unfortunately, like when you're part of the community, there's other people that don't want you to do what you really want to do. They start being, because in my experience, they over, and maybe they say it in not with the bad intentions, saying like, oh girl, you don't need that, oh girl, like, no, don't do it, like, you don't really need it, you're fine. For me, that actually always bothered me, because even though it comes from a friend or in a friendly way, I always felt like, well, the thing is, I am not doing it for you, I'm doing it for me, you know. So I don't know why that always bothered me, but it's true. Like, unfortunately, a lot of people in the community don't really want you to do the things that make you feel complete, if that makes sense.
Yeah, no,
So yeah, so what I would say is just like, just do the things for you that make you happy. And if somebody comes and tells you like, oh, don't do this, oh, you're gonna die from this, that's why my biggest advice is just do your own research as much as you can. Once you are sure you yourself that this is what you want, and then you prepare yourself for everything that comes with it. That's what I did. It worked for me, might not work for everyone, but I learned about every possible complication, and I was hoping that it didn't happen to me, but it did happen. And you see, it got fixed, and I am really, really happy. I'm really content with it right now. So just like, do things for you. And if somebody tells you, oh, you don't need it, oh, this is gonna happen, oh, your boobs are too big, why are you like doing them? It's like, well, this is what makes me happy. This I am, at the end of the day, I am the one that is going to live my life. So yeah, that's something I wanted to add.
Thank
yeah,
you, Lorena. Amanda, was there something you wanted to add?
Well, and I think, and this actually applies beyond just trans patients wanting gender affirming care. You as a patient are the consumer. So you ask questions. What are your outcomes? Do you have anybody I can talk to that had the procedure done with you? You know, what are your statistics? How much is it going to cost? If I have follow-up, how much is it going to cost? If I need a revision, do I get a discount? Like, you are the consumer and you are paying them a lot of money, whether it's through your insurance or through your own pocket. And it's important to ask questions. And if they won't answer them, then that's probably not the surgeon you want to talk to.
right.
And that includes, like I said, if you've got Medicaid or Medi-Cal in California, if you've got employer insurance, or you're paying for a Cadillac private pay policy, you all deserve to be treated the same exact way, and you have the right to ask the questions.
I think that's a very important thing, because something I noticed is like, bottom surgeries are in very, very high demand. I seen some surgeons with like such a long wait lists that I'm like, oh my goodness. So keeping that in mind, and I'm not saying like it's gonna happen, but so for some surgeons that have long wait lists, it might be like, if you start asking a lot of questions, they might be like, oh well, I don't think you are a I don't think you are a patient that I want to have, because I have so many. But if you find a surgeon that has this kind of attitude, it's better that you learn from the beginning, because that might reflect after your surgery. Like that, they might they might be like overworked. They have so many people. What I'm trying to say is like, bottom surgeries are very, very in high demand. So just make sure that your surgeon listens to you, and like Amanda was saying, at the end of the day, you are they're gonna make money. It's not like, because I saw in the past, not anymore. I haven't seen this so much anymore, but I saw And I heard from some girls that the surgeons were treating them like, I am doing a
Yes.
big favor for you, especially when there wasn't a lot of surgeons that did bottom surgery. They had decided to like, I am doing this, I am doing a very big favor to you. So you have to listen to me and you have to do what I say. And that's not how it's supposed to be, because they're getting paid, and you have to, again, it's make yourself priority and then everything else. Even if you might have to wait another year to get the surgery, just make sure that you are with the surgeon that makes you feel comfortable.
Mm-hmm. I do think that that is an important thing to touch on, especially with the way that our climate is right now, our political climate and people's maybe urgency to get the surgeries done and before maybe things change, if that is going to change.
Hopefully it doesn't.
But just to make sure, what was it that you said?
I said hopefully it doesn't change.
Hopefully it doesn't. However, there is a strong possibility that it will. Doesn't mean in our state that it will. I think in certain states it's going to be harder or easier. It's all different.
Yeah, I've seen some states banning it already and making it
Yes.
like
Yeah.
hard. And it's kind of scary because and then now what they're trying to say is the president's trying to send citizens to other countries, and then just for any probable cause. And I'm like, you're like violating our Fifth Amendment. You're violating our rights. Like,
Yeah.
even with the transgender saying that we're not women, like we're men. I think that's kind of cruel. I feel like in my heart, I feel like Donald Trump is homophobic, but maybe he had some sexual
He's a lot of things, but
with
yes,
Bruce.
that's true.
Caitlyn, maybe him and Caitlyn were doing more than golfing, and maybe they had a bad breakup, and Donald Trump said, you know what, I'm against this.
Never know. But with the possibilities to keep in mind that it's still not worth rushing to go with the surgeon that maybe you're not comfortable with or
Right.
that's not willing to answer your questions. So for anybody listening, for the idea that it's still really important that you are comfortable with the surgeon, with the process and the speed that things are moving,
Yeah.
because this is something that will affect you obviously forever, right? And so making sure that um, urgency doesn't overshadow having the questions asked and feeling comfortable. Um, is there any other maybe information, Dr. Nicole, that we haven't touched on that you feel would be good for the panelists to maybe answer or share with us, or for you to share with us?
Yeah, so since September 2022, WPATH operates under the standard of care number 8, version 8. And with that, with every bottom surgery, you're supposed to need only one letter of insurance for your surgery, for bottom surgery. The letter can be written by anyone who has letters after their name. So MD, DO, LMFT, as long as you are a therapist, a doctor, whatever. Unfortunately, certain insurance companies, and I think that's the case for Barbie, are still operating under standard of care version 7, where for bottom surgery you needed 2 letters, but this is moving less and less, and you just need one letter, not even from a therapist. You just need somebody who knows you well, that can be your primary care provider, your hormone provider as well. So this is in the work. And also, a patient dying from surgery is a big deal from a hospital. And I think this is, I'm not saying that it never happened, but it could happen to anyone entering a hospital, and not
Yeah.
just for gender affirming surgery.
From experience.
Yeah, so this would be the risk is overall low. I think the most common complication would be granulation tissues, vaginal stenosis, poor wound healing. More rarely, the risk of a fistula, that's a connection between your vagina and your rectum, and that would cover the vast majority of vesico-vaginal fistula as well. But overall, that's covered the most of the risk, but it is a procedure that is overall very safe. It's a procedure that has good result, and I think it's a risk benefit between the quality of your life and the risk that you're willing to take, and that's a very personal decision.
Yeah, that is very helpful. With the W path, it is what she was saying. I think the hard part is that insurances are not always up to speed on that. However, for those of you, especially getting care at Planned Parenthood, with them being hormone providers, they could send in the letter also. A lot of primary care could also do it. They just hide behind the I'm not competent or comfortable.
Yeah,
That's
they're kind of rude there. They're kind of like,
that's in my opinion, that's bullshit, but that's just my opinion. If they can Ozempic didn't exist, I don't know, 10 years ago, and yet all these doctors feel very competent and comfortable prescribing it. Even to folks who don't even meet the criteria. So you can write a letter of support for gender affirming care of any kind, but they hide behind that.
yeah, they try to just basically, they don't, I feel like they just want to, like, when I go there, when I first started with them, I was having a hard time because some of the nurses would like purposely call me a he.
And this is
And
at the Planned Parenthood.
yeah, and then so I had to make a complaint. And
Yeah.
then the complaint with the doctor there didn't go through. So I actually talked to a lady, Bianca, up north. It's kind of like up by the bay. It's their main office, and she kind of like she told them something, and then they stopped. But I noticed though too, like they don't really know too much information about anything. But they send in like people who are learning.
So I do think that that's the other piece, right? Is that sometimes the barrier to gender affirming care is access to competent and in kind people. Um, and so unfortunately, potentially having to travel to get the competent care, which is not an option for everybody. Before we do move towards wrapping up, was there something you wanted to say, Lorena? You did.
Yeah, so I was gonna say that for me it was also, how can I say, I would say that for me it was pretty smooth. And I know this might not be the case for everyone, like Barbie saying somebody called her he. Um, for me, I don't know what was it that everything went so smoothly the moment I talked to Dr. Nicole about this. The moment I talked to her, the only thing I will say that for me it was like this surgeon that I was gonna go with at the beginning. She ended up moving outside of that clinic, which I am so grateful for because um, after doing a little bit more research about this surgeon, I realized that she wasn't necessarily for me, but not because I was misgender. It's just like after seeing more and more results from her, it wasn't necessarily something that I felt comfortable with. So then I went with Dr. Pang, and I felt comfortable with him. But um, so for me, um, I am one of those stories that everything went kind of smooth from the moment I decided to go with it to the moment of my surgery. I mean, except for one hiccup um, that was like the changing of the doctor because of the clinic. But um, so yeah, it's it can varies from place to place. Some people, because I have a friend who actually had a facial feminization, and she went through Planned Parenthood at the beginning, and it was a hassle. I think it took her like 2 years to
Oh
actually
my
get it done
god.
because so she was supposed to go to a one clinic at the beginning, and then uh, they made her do a couple of things, even the CT scan for her face, and then after that they told her, "Oh, we have a wait list of almost 2 years." And then she started looking because she didn't want to wait. So yeah, it varies in different places with different clinics. So just make sure, again, I go back to the same thing, just do your own research before starting the process.
Yes.
Yeah. Before we maybe, I don't know if
Gosh.
there's any other topic for us to talk about, but is there anybody who's listening or in the audience? I know there's only a few of you, but do any of you have any questions that you would like to ask? Yes.
Hello, how's everybody?
Hi.
Good. My name is Jana. I'm just here supporting Amanda. I have a transgender son, and so I'm very familiar with that process, but I am not familiar with Transfemme process at all. And so Amanda invited me to come along so I could just learn a little bit about what your experience has been. I just want to thank you all for being here and educating me as a cis woman as far as what your process is. So I love you all. Thank you.
I love you too.
Yeah, thank you.
There is on our YouTube, on Trans Emotions YouTube, there is videos for the trans mask bottom surgery that may pertain to your kiddo. So if that is something that you would like to see or look at, that's there as well.
Awesome.
And I don't know where you're located. However, for Gender Confirmation Center on Instagram, they do a really good job of just normalizing what post-op outcomes are for trans mass folks. Well, for anybody, but just resources for you, for your child, if that's something that they are interested in. It's one of the things, and we didn't talk about it in this panel much, but having realistic expectations of the outcome is a huge part of it, and which is also a huge part of making your choice, right? Whether that's for top or bottom surgery, male or female, just knowing what your options are and what realistic outcomes are of that, because right, sometimes that's part of what leads to our emotional reaction after is not having the realistic outcomes in our mind of what could happen. So those are just some resources to
Thank
consider.
you. I appreciate that. Thank you all for your time. I've learned so much, really. This has been great. Yeah.
That's
Perfect.
Thank
you.
you.
Thank you.
This
Thank
has been
you.
a great
Thank you for being here.
opportunity.
Love you, Amanda.
Love you. Thank you for coming.
Thank you.
Oh,
Is
wow.
there anything
To
that
say
you
about realistic expectations that knee replacement surgery, which is a very common surgery, has a 30 to 35% regret rate. And still, with the data that we have for any gender confirmation surgery or gender affirmation surgery, the regret is still below 1%, which is pretty exceptional.
Wow.
yeah.
Yeah, I mean, despite my current situation and not having the results I wanted, I have no regrets about the procedure.
Mm.
I think I had some unrealistic expectations about dating and how men are. And I found out if men are jerks, men are jerks.
That's
So
true.
don't
Yeah,
expect
men
the
are
surgery to fix it.
Men are.
I do think that that is the important piece, right? Is keeping that in mind of our realistic expectations for ourselves is what we would want for it to look like, which is definitely a conversation that I have with a lot of my clients and making sure that they see pictures and they see outcomes of like best case scenario, maybe not best case scenario, so that they can decide if this is what they want to do, but also having realistic expectations of what it will mean intimacy wise. Because oftentimes there is that feeling that maybe more acceptance or more options, for lack of a better way of saying it, or will be there when in fact maybe it's not. Sometimes it's yeah, who we're picking versus the other problems that may be coming up of it.
I think
Yeah,
I think for me, the fact that um, I already accepted myself, kind of like going into the surgery. It made things also very, very easy, So, um, so yeah, when it comes to, I want to say this for what Amanda said, that when it comes to men, I mean, I am married and I have a very supportive husband, but I think even if I wasn't, and if I was gonna do it, I was still gonna do it again for me, just for me, not because like I wanted to be accepted by men, or not because maybe sexual encounters were gonna be easy, because honestly, I still love myself the same way I loved myself before. Yes, I had dysphoria for my genitals and I had the opportunity to change them. But at the end of the day, like, just love yourself, and love yourself first, and then everything else, it will be a little bit easier.
Yeah. I think also there is the conversation about and this is not just with bottom surgery, but in the transitioning, if you're going through this process with a partner, also them having the realistic expectations, right? And then potentially asking the questions, because that doesn't mean that should change any choice that you make, but they should be very much aware of what it means. And now if they choose to not stay in this relationship, that's something totally different. But
Yeah.
to make sure they're not projecting those expectations onto their partner. So if you are in a relationship considering bottom surgery, those things also need to be a part of the discussion
Yeah.
in that they just need to be prepared, whatever that
That's why
means.
my boyfriend broke up recently, because he doesn't want me to get the bottom surgery.
Right. And so
Yeah.
it is knowing that it's going to have a
Yeah,
relationship
it was
impact.
like a 2-year relationship, and as soon as I said I want the bottom surgery, we broke up. Like, he
And
broke up with me. Like,
yeah.
he didn't want that. And sometimes it's hard because, like, like, I buy gaps and things to tuck,
Mhm.
and those things don't work as, like they're supposed to. And I'm tired of tucking, and I'm tired of, seeing that, my private part. I take hormones and it doesn't work. And I'm not trying to be nasty or anything. And
No.
I'm doing this for myself. That's why, like, he had said, well, this is for the both of us. And I said, no, this is for me. You're not the one that's going to go under the knife. This
Right.
is my body. I'm doing this for myself. And I think that's where he took its whole, was like, okay, you're doing it for yourself. You're not doing it for me. But why would I do it for him? He's not the one that's going through the process. You know
Yeah.
what I'm saying? So
Yeah.
we've been broken up like a few months, but I feel kind of happier that we've been broken up. But there's more men in the sea, and like I said, there's gonna be someone that's gonna want that for me. Like, I'm not gonna sit there and stop in my tracks, because if a man doesn't want me to do it. No, I'm gonna do it because for myself. And this is something, a dream. It's not an easy process. There's times that I feel like, is this what I want? But then I have to tell myself, don't recollect it, don't overthink it. Just, this is something that you've been doing, wanting. So I have to learn.
And in
Yeah.
this process and transitioning in general, whether it's in the very early phases, as you all know, of that process of transitioning, sometimes relationships they do end because of it, but it's definitely it's more about your long-term happiness, and sometimes relationships have to end for us to grow, and it's just part of it.
Yeah, because the last thing you need is stress or complications, during the process. Because
Yeah.
even like with my the top surgery, like, we were together, but I feel like he was putting more of a stress on me. So they even made me stop my hormones. And I think that's what more, like, made me see more who he really was, because, I just felt like, I don't know, just I feel like sometimes people put pressure on you and they don't want you to succeed, like I was saying earlier. But
Yeah.
like, if you're gonna do the surgery, just make sure you're doing it for yourself, not to
Yeah.
impress
And
somebody.
I want to add that what was gonna say when it comes to the expectations. I have seen over the last few years that some girls, and this is talking about relationships and stuff, right? Some girls think that they feel that a couple of people rejected them, and they think like, oh, the surgery is gonna come in and it's going to resolve all my problems.
Mhm.
That's where I am sharing with you and with everyone who might be listening, that it's very important that you accept yourself, that you love yourself, and that everything that you do it for yourself.
Yeah.
Learn about the outcomes, the consequences. Have realistic expectations that no matter what you do, there's always going to be someone who doesn't like you. There's always going to be someone that might reject you for whatever reason. I have seen so many cisgender females being rejected because they have they have a eye bigger than the other one, or they look to one side with one, and like this type of things. So some girls I saw over the last few years that, oh, I'm gonna have bottom surgery, and then suddenly everyone will want me. It's not the case. It
No.
will never be the
If they
case.
didn't want you in the beginning, they're not going to want you then.
Exactly.
So like that was the challenge for me. So surgery was not covered under insurance when I started my process. It was $85,000 out of pocket. You might get a cash discount of $20K. And so I used my dating card won't be as full as an excuse. I lived in San Diego, so I had Navy boys, interested. But then I realized they don't want you. They just want the experience or whatever.
As a fantasy.
Because they're not there at the end of the day. If I saw them on the street, they don't want to talk to me. So I had to realize this is not love. This is obsession. I have to love myself and do what I originally wanted to do, which was go through this process. It took me a long time, and thank goodness California changed their laws and insurance came into play, and all I had to do was pay a copay, but also be realistic about the expenses. So even though my insurance covered it and I only paid $500, I had to travel there and back, and it cost almost $4,000 for me to be there for a week in San Francisco with food and travel and hotel. So you've got to be realistic about everything.
Yeah.
Yes.
It's not cheap. Even with insurance, it's not cheap. That's
No,
for sure.
it's not.
Yeah.
It's very expensive.
And I think that is an important piece that a lot of folks have the barrier of not being able to either. For those of you who are not on state insurance, who may be on private insurance, your out-of-pocket cost, the percentage that you may have to pay as far as your copay, but then the expectation of having to stay near the surgery center for the week or whatever it may be. For those in our area of the Central Valley, we do have some resources to help with that. That's more towards Fresno and Madera County as our community care grant, but also having gender affirming providers like Dr. Nicole who are willing to help with after the surgery's recovery process or any complications, though there aren't as many Dr. Nicoles as we would like or need.
No,
So
there's
having
not.
those resources, yeah. Is there anything else you all would like to add, or do you feel that we've kind of covered everything?
I was really close to retiring. I'm not going to lie, but this new clinic really gave me new breath. And, we're training more doctors. And I think, speaking of the Central Valley, we're in a very different place than we were when I arrived 10 years ago. And we have a lot to be proud for the work we're doing.
Yeah, it's definitely the work of and training Dr. Nicole and Dr. Howard, who's not on the panel, but Dr. Howard is not a surgeon for bottom procedures, but um, having doctors that are training residents and upcoming doctors who in their residency, or they may be here in Fresno, but then they disperse, right, as they move into their careers, but having more providers who are exposed to gender affirming care, so they are willing to do the letters if they're primary care, or OBGYNs willing to look after trans females after bottom surgery, and the importance of those providers. So it is something that we are working really hard on here in the Central Valley, and I know that they're working very hard other places in the country to also be able to improve that. But yes, just having more providers willing to do aftercare also would be a huge reduce in the barrier.
And
Go ahead.
again, that's another. I want to mention that's another big factor for me. I don't know if I already said this, but the fact that I felt confident that I had a local provider, which is Dr. Julie, who who told me like, I have the experience. I've been seeing transgender female. I've been treating them for a long time. That also made me feel even more confident about going through the surgery, because again, also I heard stories from, for example, in her case, that she needed to travel drive hours to just see a primary care doctor, for any complications. So yeah, it is, unfortunately, it's not everywhere. Here in the valley, we have Dr. Nicole, and for example, with my primary care, they are also adding a doctor. I don't remember his name, but this year they were gonna add him, which